Okay, thank you, Sophia. Okay. All right, well, I'll start, and if there may be a few people who come in late, but I'm sure they'll catch up with us. So I'm Kathy Jenkins. I think most of you know me. I'm here from Scottish Hazards and from Unite. And we thought, although we know everybody is still heads down on COVID and will be for a while, we thought it might be worth taking this chance to look at health and safety and just put our heads up a little bit and look forward at what we ought to be looking for, what we want from coming months, you know, what we should be arguing for, how we can build a better movement. And so that's our plan for this evening. I hope people think that's okay. We've got two speakers, which will hopefully give them time to speak, but also give us time to have a bit of discussion. So we've got Hilda Palmer, who is going to speak first, who's from UK Hazards and from Families Against Corporate Killers. And we've got Terry Anderson, who's one of the main health and safety people in the Scottish Trade Union Congress. So we're going to start with Hilda looking at the kind of broad brush, what do we want to call it, future, and then Terry looking more specifically at Scotland, if that's okay. We'll have a little bit of time after each one for people to ask questions. So because there's only two speakers, we should be able to do that. So can I introduce Hilda Palmer, and do you want me to put your slides up now, Hilda?
Yes, please, Kathy, that's great. Thank you very much, everybody, for inviting me to speak. It's always a great privilege to speak to people and to speak to all of you from north of the border. That's absolutely brilliant. Okay, I'm going to talk, as Kathy has asked me, about beyond COVID. I think it is really useful to be able to look ahead, and I think we do need to do that. There will be an end to COVID eventually, though the appalling mishandling of it, everything that we know about the corruption and the cronyism and the profiteering from a pandemic, you know, and the lack of PPE and the setting of PPE standards to meet supply, not health, the lack of any strategy to suppress the virus or protect workers. We've got 10,000 plus workers at least dead, hundreds of thousands probably suffering from long COVID and all the rest of it. We've got a very, very long way to go, but it is important that we do try and look beyond this. And so what I'm going to try and do is a bit broad brush to look at, you know, what we need, but what we're aiming for and what must be our number one priority is healthy and safe work centered on precaution, prevention, protection, and participation. And obviously, we want that work to be greener, cleaner, more just, more fair, more equal. And I think we do have to just realize that what we're going to face when we do come out of COVID, whenever that is, will be a workforce traumatized by COVID. Not just, but especially healthcare workers and social care workers, frontline workers, bus drivers, teachers and whatever, but all workers will have been affected in some way. I mean, many have lost their jobs, many have been driven into poverty, many are suffering from bereavements, many are suffering from long COVID. So we are going to have a huge, probably a huge amount of mental and physical ill health. Next slide, please, Kathy. I think we must remember that pre-COVID health and safety at work wasn't good enough anyway. It was pretty damn poor. And our three sort of main slogans, we didn't vote to die at work, continually telling the government and employers to stop it, you're killing us, and the fact that we love red tape because it's a hell of a lot better than bloody bandages is the reality of it. Nobody should die for going to work, but they do. At least 52 or 3,000 people die in Great Britain every year because of incidents at work or because of illnesses. That's about 140 people a day. That's a huge and terrible and unacceptable toll of the workplace on workers' health and lives. And it's something that we should never accept. And we are continually having to tell them to stop it. They're killing us and they're hurting us in every way. And that we need better regulations, better enforced. Next slide, please, Kathy. Rory O'Neill from Hazards magazine has said very clearly, you know, COVID didn't create the workplace health and safety crisis, it exposed it. And I think that's absolutely right. Workers have been abandoned by the government and the HSE. It's been left up to them to organise and try and protect workers in every possible way they actually can. And safety reps have done the most incredible things all across the country, which has been really important in terms of showing non-unionised workers what can be done by working together. And there has been an upsurge in unionisation. There's also been a massive increase in not only people joining unions and becoming more active, but many, many more people becoming safety reps. They've done an absolutely incredible job. But COVID has really exposed how unsafe our workplaces are, how unhealthy they are, how we lack the laws and the enforcement we actually need. And what's been particularly exposed is the appalling conditions in many of our workplaces where ventilation, not only is it not really good enough now for COVID, but it wasn't really good enough for workers' health beforehand. So there are a lot of things that we have to put right. Next slide, please, Kathy. I think we have to understand that health and safety is really all about inequality. And this is an article that Rory wrote in Hazards magazine some years ago for Workers' Memorial Day, you know, that we're all sickened by inequality at work. Health and safety at work is all about inequality, and our fight is always to reduce that inequality and fight for safer and healthier workers for work for all. It's about class and it's about race and everything. The lower paid you are, the more likely you are to be in insecure work, the more likely you are to be injured, to be made ill or killed at work, and to live shorter, less healthy lives than higher paid workers or people who get their income from other sources than actually working for it. And then if you add to that the intersectionality of race, ethnicity, sex, age, disability, and others probably, makes inequality at work even more toxic. And just looking simply at sex in terms of COVID, you can see how workers, healthcare workers have suffered, women healthcare workers have suffered particularly because the PPE that they're having to wear for intolerably long hours every day isn't actually made for women workers. It isn't made for their faces. It isn't made for their bodies. And they're suffering extra especially because of that, because sex and the differences of women's bodies isn't actually incorporated properly into health and safety. I think it's really important to think about race and ethnicity in all of this. We hear a lot about the fact that Black and ethnic minority people and workers are much more at risk and are much more likely to be made ill or die of COVID. But this is really related to the work they do and how they're treated and how much they're paid. We hear that people living in more deprived areas and in worse housing are more affected, and that's because people aren't paid enough. That's because of the work they do, and we have to work very hard to guard against the idea that this is all cultural or genetic. And there's been a really horrible resurgence of, well, almost race science throughout all of this, and we have to fight quite hard against that. And we've seen that areas of higher air pollution have seen higher deaths from COVID. And again, that's because poorer people live in areas where the air is more polluted and they work in more polluted air and all the rest of it. Next slide, please. We know all the evidence, and it's not just coming from us, it's not just coming from trade unions, it's not just coming from the TUC or the STUC. There's a huge amount of work which Hazards magazine has under a headline, The Union Effect. And you can go and look at all this academic research from all over the world about the fact that organised workplaces, union organised workplaces are twice as safe, twice as healthy, half as many incidents. This is all really, really important. It makes an absolutely massive difference to workers' lives. It's important that we're unionised, but it is also important that we have strong laws and we have strong enforcement. We're saying very much at the moment that workers are left on their own and it's up to them to make their workplaces safer. And that's a default position we find ourselves in, and one of extremists. But it's true, we need strong laws and we need strong enforcement to back us up, and we have to fight for that as well. Next slide, please, Kathy. So saving lives at work requires occupational health and safety to be recognised as a fundamental right. This is the theme for International Workers' Memorial Day this year, the 28th of April, every year since the 1990s, where we remember the dead and we fight like hell for the living. This is the theme this year. We know that workers have to have a right, a legal right to safe and healthy workplaces, and that has to be enforceable. We know that the International Labour Organization, a tripartite organization, has not been able to get this through, even at its centenary conference, to actually include it as a convention, because employers have fought against it. And that is why we are making that the global theme this year. And that's really important. It's important everywhere, but it's very important here in the UK, because COVID has shown us that we don't actually really have that. Next slide, please. In 2019, the Hazards Campaign produced a manifesto for the election called Decent Jobs and Decent Lives. And we basically explained, why the health and safety system in the UK was broken and what was needed to fix it. Because huge numbers of workers in the UK have absolutely no way of getting their right to a safe and healthy workplace, which is enshrined in health and safety at work law. They have no possibility of getting that enforced. So we made it clear that we needed an end to deregulation, to restore the idea of regulation and enforcement as a social good for workers, but good for everybody, and to develop health and safety systems based on prevention, precaution, protection and participation, and to fund them properly, make them independent of governments and free from ideological interference, which we have seen playing a very deadly and lethal role, particularly in the COVID epidemic, and to provide those real and enforceable rights for workers, particularly those in precarious work. Next slide, please. And we've continued this, we've extended this very much into our 10 organising principles, which the Hazards Campaign is taking forward this year, some of which we've actually taken from the Scottish Hazards Centre, from your Scottish Hazards Campaign, from your manifesto for your elections coming up, particularly number 10, which is the development of a toxic use reduction programme. But basically, everything in there is just developing what we have said we need to make work safer. And a precautionary approach is what we want always to lead the way and to protect workers. Next slide, please. So really, we have to educate, agitate and organise. There's no silver bullets at all. We have to develop and build power, and we have to work for, a greener rebuild for a healthy future. We have to get people to join unions, and if they're members of unions, to become safety reps. It really is very pathetic that we only have 6 million workers in trade unions, and that's not just because of workers. We know what caused that: anti-trade union laws and attacks on workers' rights. We know that, but it is really not good enough, and we're not developing enough power if we don't get many more people to join trade unions and to become active within them. But that means, that we must support unions more, and we must support health and safety reps, and use whatever information and programs we have, like our manifesto and like the Scottish Hazards Manifesto. And we have to pressurize unions to make health and safety a top priority. It isn't. Health and safety, what safety reps do, has become very clear and very important throughout the COVID pandemic. And for a while, it looked like everybody really understood how important this was. It's not true that really has been carrying through into what unions are doing. It's not clear that those will remain their top priorities, and that they will resource and campaign for that. And that unions will be democratized and have more grassroots campaigning. We are going to have to fight for that. And we are going to have to fight for these as equality and human rights and justice issues. and internationally, you know, and campaigning for the fundamental right for all workers globally. And we can do that through things like supporting International Workers' Memorial Day this year, and supporting, you know, the organisations like Scottish Hazards and the Hazards magazine. So those are just some of my ideas about how we have to go forward. There's no easy sort of bullet, but I think that sort of lays out some of the tools, some of the things we've already done. And I would just draw everybody's attention to the fact that the Labour Party has just launched Workplace Power, Recover, Rebuild, Power in the Workplace Task Force, which is going to be taking evidence about how we can do that. And obviously the Hazards campaign, and I suspect Scottish Hazards, will be feeding information into that. And we're going to have to work really, really hard to make safe work for decent lives and decent jobs for decent lives absolutely at the centre of it. COVID has proven very clearly that workers' health is public health. If we don't look after workers in the workplace, then we can't protect public health. I mean, we should be protecting workers anyway, but COVID has shown that we can't neglect workers because it's going to damage all of us anyway. And I think we have to find ways to push these messages home and fight really hard on the back of it. Thanks very much.
Thank you so much, Hilda, for that. Wow, I don't know where to start. Actually, what I'll do is I'll say, first of all, is it okay if we circulate your slides?
Yes, of course.
Yeah, so I'll do that to everybody that is here.
I'll send you a slightly update. I've updated the last one. I'll send you that, yes.
Okay, that'd be great. So can I just, we have some time now for questions and short comments for Hilda or to Hilda. We'll have more time for longer discussion afterwards, but specifically things that have come up through that. So let me know if you, okay, Penny?
Yeah, thank you so much, Hilda. That was superb. I just want to pay testimony to, if that's the right word, to the TC safety reps that I've been teaching during lockdown for a year, because what you said about inequality really chimes, because a lot of them were health workers working with asthma through the menopause with unsuitable PPE and long shifts. And, you know, it really, you know, is inspiring and heart-wrenching at the same time that they said it is possible to use this PPE when you have asthma because we breathe shallowly and we can manage it. And my God, you know, the amount of, it's been heroic what they've been through in this last year. They've lost relatives. I've seen ambulance workers working huge shifts, producing so much detritus every time because the sense and common sense of organizing it so that some ambulances would be COVID specific was never accepted by management. And it's crazy. So they had to decontaminate every single time, slowing the whole process down, etc. And firefighters, you know, who have been working and losing their remission, by the way. So, you know, they were training, but no longer getting any training time off and things. So the amount of sacrifice that safety reps have given in order to try and keep their members safe during this period, I have never seen the like, and I think we shouldn't forget it. And I was just going to ask though, Hilda, what the theme of the Workers' Memorial Day is, because obviously COVID is in everybody's minds, and I just wondered what it was.
Well, the theme is that we want a fundamental right to safe and healthy workplaces globally. That is the Workers' Memorial Day theme, which obviously applies to COVID, but you know, it's broader than that. And I think that's really important, is that we do want to focus on work and the workplace, because it's the structures of the workplace and the lack of you know, proper law and proper enforcement that is handicapping workers in terms of defending themselves and defending their members and protecting everybody. That's actually at the core of this. So we want, you know, this is an international theme. It's a global theme. It's important for everybody, but it's very important for us here. And we do want to focus on that it obviously will include COVID and includes people, workers who've died of COVID or are suffering from COVID. It will include that, but we don't want it to be just solely about COVID. We need to remember everybody who's died from COVID, you know, at other times. But on Workers' Memorial Day, we want to focus a bit more on the structural causes of all of this and how we must attack this, while also remembering the sacrifice of workers. I think you're absolutely right, Penny. You explained that really eloquently, and I think that, you know, there's a huge danger, isn't it? Workers are essential workers and key workers when we want them, and as soon as we finish clapping for them, they get kicked in the backside, and who gives a sod about them? And they, you know, Boris Johnson and the rest of them profiteering off the backs of workers' sacrifice. We have to make this visible, and we have to keep on talking about this, and we have to speak out about it. You're absolutely right.
I've got Des and then Donnie.
I just had a question for Hilda, really to pick her brains in terms of a national experience, and that is, I'm quite concerned when I'm reading about and finding out about the operations of Amazon. You know, that it's boomed during the COVID thing. A lot more people are ordering stuff online. There's not just Amazon, all sorts of firms.
Yes.
I've seen Amazon drivers scooting around the city during all the snow we had, dashing out parcels you leave outside people's doors.
Yep.
You read about all sorts of health and safety issues about a firm like Amazon, these online firms, and the type of workforces they have and the conditions under which they work. I just wondered, I mean, I'm not saying we, particularly us here, but I mean, obviously Amazon's getting a lot more business from the British public than it used to. And I just wondered whether there's if you like, what should we be saying to Amazon as customers of Amazon? And given that they get so much of our business, you know, what do you think the public or the trade union movement itself should be saying to firms like Amazon? You know, should we boycott them, or what do you think about the health and safety issues of organisations like that?
That's a really, really good question. And I think it's true that Amazon's one of the worst, of course, but all the online retailers, we know they had absolutely appalling health and safety conditions before COVID. And we know that, you know, there are huge battles in, you know, the retail warehouses and the way they're all rushing around like, you know, blue ass flies and not being given enough time. And we know that with extra business, they've made massive, massive, massive profits, but we know that they're also not treating their workers well. But the only answer to all of this is, I think all of us should be making much more of a statements about it. And I think when we're using the services, I think we should be finding ways to make our views known. But it is to support those workers in those workplaces to get organised and actually to start fighting back. And to support the enforcement of the laws that we actually have, to be demanding that the HSE is going in there to those sort of places and the local authorities and doing spot inspections and actually, imposing prohibition notices or fining and prosecuting the companies that are not carrying out the most basic of precautions under COVID, the social distancing, the cleaning, but also ventilation, which is absolutely incredible. I think we just have to keep up all the publicity and all the pressure and the awareness of that. And I think we must remember ourselves that, while we're workers and we're working at home and ordering things online, we've got to remember those, it's about solidarity, isn't it? It's solidarity with those workers and trying to find ways in which we can do that, in ways in which we can make those links with those workers and make clear what's actually going on there and try and, help them to organize and help them to make demands which we can then support. It's a very good, very, very big point.
Thanks, Hilda. Donnie.
Yeah, it's a question, and I don't know if it's a question for Hilda or Terry or both. It's about the difference between England and Scotland. Yep. In a couple of areas. First of all, in terms of language, the Scottish government talks about consultation with the unions quite consistently, and yes. It actually does happen sometimes. I mean, I'm a rep in a college, and every Monday, I meet the management for half an hour and we talk about the latest COVID events, etc., etc. And I'm also part of the, my union, I meet with the civil servants once a fortnight and talk about COVID, etc., etc. And I'm just wondering how it's working down in England, if there is any of that sort of thing. And the second question which follows on is, in practical terms, is there any difference? Because, you know, because the language is different. But I'm just wondering in terms of the health outcome, whether you think that's the case. And as I say, I apologise if it's just for Hilda or Terry or whatever, but I'm just interested in the differences and the similarities.
I think that's a very, very, very good question, Donny. I think some of that will depend on how strong and how well organised different workplaces are, and some well-organised workplaces will have levels of consultation with their employers on a regular basis. Some people have actually, you know, won a great deal through COVID in terms of making things safer. A lot of workers haven't. I think in general, I think there's far too little of it, and there's a great deal of abuse of workers during using COVID as a sort of shield. And I think what hasn't helped in England is that it's very, very clear from the government and from Public Health England and from the HSE, which I know some of the HSE stuff will be common to Scotland as well. It's very clear that there is no backup for workers. And when employers know there's actually, you know, no real backup for workers, when workers are asking for, you know, better PPE or PPE at all, or better PPE or better ventilation, and then the employer is saying, but this is what the BEIS, the business department guidance says, and this is the HSE backs us up on this, then it undermines workers incredibly. I think there is also a thing that your employer can consult with you and give you time and listen to you apparently, and still carry on and do the same old thing. And I think they've been getting away with that. I don't think there are huge examples of, you know, of employers covering themselves in glory in England throughout all of this. But you do have, you know, some things in Scotland where, you know, trade unions and safety reps have been given a little bit more of a platform. And I'm sure that very good ones and people like yourselves will have used absolutely, you know, show you an inch and you will have pushed open doors and you will have done huge amounts of things. And I think that's very good, but I'm not convinced that there's a huge amount of difference. And certainly in terms of what school teachers think about what's going on in schools there, I think people are absolutely as pissed off as we all are down in England, really.
You want me to come in? I think I'd probably answer that quite simply, Donny. I mean, I think the relationship appears better, but I'm not sure the results match the relationship difference, if you know what I mean. Yeah. So yeah, I mean, I think it's good to have that relationship, and there are, you know, the openness to roving reps, but there was no push to, I mean, I'll talk about being involved in the roving reps, but we've not got enough health and safety reps to have roving reps, so changing legislation is required. So yeah, the relationship is, there's two bits of work. I work in the STC where I directly liaise with the Scottish Government. The relationship is good, they're generally supportive. I think that's good, but I'm not so sure the difference in the results matches that. And I sometimes wonder, is it a case of keep your friends close, but keep your enemies even closer? You know, a wee bit, you know. So sorry if that's a lot.
Thanks, Terry. We'll hear from you in a minute. You can say more. No, Ian.
Thanks, Kath, and apologies for coming in late. I couldn't get in. It's a question for both Hilda and Terry. I actually think that I've said this to senior management in the City of Edinburgh Council recently, and to politicians, that I think the Scottish Government, and no, I support the SNP, but I think Nicola Sturgeon's actually done a far better job than Boris Johnson. Let's face it, couldn't get much worse. But the fact of the matter is that they have made two fundamental mistakes, and that is when they both come to the decision to reopen the education establishment. There is no doubt in my mind that they've been wrong twice in that. And we did certainly see a big spike in Edinburgh schools when the schools were reopened back in August, and we had to do, I'm the health and safety officer for Unison Edinburgh, and we had to do a hell of a job along with the EIS to get what's called a SORT document in place, to get the safe working procedures and the risk assessments all done. We're now having, there's 12 versions of that, and I was involved in that, quite a lengthy document, set up working groups, and we're now going to have to go through that again because of the new variant. And with opening the schools next week, and no doubt further education colleges and universities will not be far behind either, mainly because of the sheer greedy university, when, you know, the universities getting people back. But what's came to light recently in Edinburgh was that we've been campaigning to try and get the actual numbers of positive cases of staff catching COVID within each of the directorates and the departments, so that we can identify where there is sources. We've been trying to collate this for months. We ended up having to pull in the HSE because there was no risk assessments in health and social care. I've now found out there's no lone working procedures. I've been seconded onto 2 groups. And over the last couple of weeks, we're now getting what they claim to be the correct stats. Now, out of a workforce of 18,500 member staff in Edinburgh, we've got 484 positive cases. Not one of them has been registered as a ridder with the HSE. And when I called them last week to speak to the HSE advisor, I got the usual bill, which I did the last time with the risk assessments, kept on the phone for 40 minutes and then told to fill in the template and fill in an FOI if I wanted the further information. I then told them that I wasn't going to do that. I went and had a meeting the day with our corporate health and safety manager. I've been in back-to-back meetings with several senior managers all day, and I've said to them that we now have to go through our incident reporting mechanism to look at where all the anomalies are in the reporting system. I actually believe that 484 recorded incidents are treble that amount, because what's came to light today is they haven't put the health and social care numbers in. They haven't put the police directorate, which is mainly manual workers, or ex-manual, sorry, and they haven't put safer and stronger communities in, which also involves criminal justice. So the point I was going to make was their fallback position, and this makes me really angry. They keep on telling me we are following the guidance, not only the Scottish Government, which is pretty weak anyway, but also of Health Protection Scotland, which says that all positive cases of COVID are community-based. Now, I've given them, the HSE, 2 examples. One was a special needs school where we had 14 cases in a week, 2 kids, 12 staff members, and they're claiming that was COVID, that was community-based. We also, in the street cleansing depot, had 3 cases over 4 days. And I've tried to explain to them the guidance is wide open and it's open to interpretation. You cannot have all these cases being community-based. Sorry for going on, Kath.
That's okay, thank you.
Sorry, I should have said it worries me because I've spoke to other local authority colleagues for Unison.
Similar.
And the guidance as well for Health Protection Scotland is that's a similar throughout Scotland.
I think this is that's incredibly important, Ian. You're doing incredibly good work there, and you've got a load of really good and very damning information. This whole issue about not counting all the cases, not reporting them under RIDOR, the HSE strongly advises against that. And also these massive assumptions that are being made because of the way in which they're investigating cases, where they do investigate them. They're doing it in such a way that they will only find the cases that they want to find and that they can say are due to people being too close together or whatever. They do not look at the ones that can be due to airborne traveling some distance where workers are working together, and therefore because then they come back to the idea, well, people are washing their hands and people are far apart, so therefore it must be from the community. It's complete circular bollocks, and it's very, very damaging, and it's just reinforcing the whole idea that the workplace isn't a site of infection and transmission, that it's all coming from the community. It's because people are sharing cars, it's because people are mixing as households, individuals are misbehaving. You know, there have been 50,000 fines and prosecutions of, you know, ordinary individuals for breaking the rules, and there have been absolutely no prosecutions, no prohibition notices of employers, and it's all because of these entirely false assumptions. And you know, what you've identified is a system that's designed to maintain the transmission and infection within workplaces and not actually get to grips with it, because it's like, you know, Nelson and these, you know, I see no ships. It's an absolute scandalous crime, and you're obviously helping to reveal that, but it's built in to the whole system, and the false assumptions and nonsense and not following the science. The HSE has completely abandoned science and is just following Public Health England and doing whatever the government wants and backing off actually preventing COVID from being transmitted in the workplace. It's an absolute disgrace.
Okay, I think, Penny, I see your hand is up again. I do want to give Terry a chance to speak. Is it something quick?
Yeah, it's just directly in relation to what Ian's just said, so I will be quick. Apologies for coming in twice. That's absolutely disgusting to relegate safety reps and reps to the status of somebody walking past a workplace and deciding to put a freedom of information request in is tantamount to derecognition of the union, because we've got the SRSC regs, for safety reps Bible, if you like, which says regulation 4A, they have to give us that information, whether we ask for it or not. It's the only thing that isn't triggered by our asking. They have to give us that information by law. And, you know, we could slap an inspection of documents, as I've mentioned to you, regulation 7, within 3 weeks, 2 to 3 weeks, not 40 days. And that is disgusting what they're saying to you, and they should be ashamed of themselves. My one brief question is, for hazards north and south of the border, I'm really worried about the way the stats are being drawn up, so that every day on the television we see questions of death rates of people who within 28 days of a COVID yes, you know, that they have got COVID, that they die. And that is excluding so many people who come back when they've got long COVID and then, you know, experience, you know, organ collapse, etc., that we're seeing more and more of. It's something like, I think it's something like 1 in 5 workers who've been hospitalized in the first place find themselves dying of something along the line and are not being picked up by those statistics. I think I've got the feeling the death rate is much higher, but I just was interested in what you feel about that.
I think it is, just very, very quickly. Yes, I think everything is being fudged, everything is being faked, everything is unreal. And yes, we think the death statistics are much worse. 30% of people who are hospitalized, who are ill and hospitalized, actually return to hospital after that time period, and 12% of them actually die, let alone all the long COVID and all the rest of it. Yes, we are not being told the truth. They are fabricating the whole thing. And yeah, but it's great, good shout out for the safety reps and safety committees regulations. The biggest thing that's happened during the whole of COVID is the government has allowed and has sort of decreed that weak, pathetic, unscientific, non-science, nonsense bollocks actually predominates over the Health and Safety at Work law, Health and Safety at Work Act. They've actually relegated all of that sort of law by putting in the, you know, public health case and focusing all on on the assumption it's not the workplace, it's the community, and it's all absolutely wrong, and we'll never get out of this until we actually do that. Thanks, Penny.
Thank you, Hilda, and thanks everybody for all those questions. I'll just abuse the chair for 1 minute to say that our caseworkers for Scottish Hazards have just done a report of all the cases in January, and we normally get 40 a month. We've had 120 in January. I mean, it's just ridiculous. And a lot of them are about workplace cases, about workplace spread, which is clearly workplace spread and, you know, couldn't be anything else. So I can maybe say more about that later, but I just want to say that there's definite, you know, evidence there. Okay, I'm going to now introduce Terry Anderson from STUC, and ask him to bring us back to Scotland a wee bit.
Thank you, Kathy. I'll do better than that. I'll bring you to Portobello. How's that? Even the seaside resort. Nice. It's good to be here, and thank you for the invite, Kathy, and Edinburgh TUC. I'm Terry Anderson. I work for the Scottish Trade Union Congress. Yeah, I was just thinking on Ian's point there as well. I mean, I think what outlines to me is the importance in Hilda's presentation about, you know, the deregulation of regulation almost. You know, it's the power of investigation is still such a powerful tool for health and safety reps. You know, and it was kind of one of the first things I learned, that, you know, there's power in that, being able to probe and investigate. You know, and so, you know, more power to Ian. And you know, it's difficult, but when I'll talk about later, we've got these community reps, and when I sometimes think about what if they weren't there, it's quite a horror thought, you know. So you know, there's a lot of good probing and investigating going on. But yeah, I mean, I'll just tell you a bit about my background. I worked for the STC since 2005. Before that, I was I was a train driver. I was in the railway for 12 years. I was an ASLEF health and safety rep, and left the railway to go and work for the TUC, and went back into education to do sociology and community studies. I worked for the TUC for a year. It was primarily on an organising campaign in Doncaster, a company called Polypipe. And the main organising focus was health and safety, because the injury rate to workers was horrendous. Mainly Middle Eastern workers that have been injured, you know, mainly limb injuries. But you know, when something happens to one of your limbs, it's no minor, you know. So, but sometimes they're classed as a sort of kind of like, you know. So, but we built a campaign around that, and we won that campaign for trade unionisation by 1,250 to about 400, you know, but it was built around health and safety. And it was built around the premise that people have got the right to go to their work in a healthy and safe environment, and go home, you know, in one piece, safely, you know, and, you know, the workers got behind that, and they recognised that. So from there, I came to work for the STUC. I said I was in education. I actually got in touch with Ian Tasker, who was at STUC at that time, around about the Mary Hill disaster. I was involved in that at the factory there, and I did a bit of kind of community liaison, got community groups involved, and then joined the STUC as a worker safety advisor. I worked at that didn't get funded, actually. I mean, despite the fact, I think we had like over 1,000 workers filled out forms, you know, about their safety issues, because it was non-union work sites. The HSE, and I think it was the Department of Work and Pensions, didn't fund that. So I moved on to be the community development officer. And since then, I've worked on Support at Work, which is an Edinburgh-based employment rights support project, and Unions into Schools. And, you know, Unions into Schools and Support at Work both have a health and safety component to them. I have to say, and if I'm being honest about it, health and safety, we're going to have to look at, and we're happy in schools. It's sometimes not been the subject that teachers have been asking for, but that seems to be changing a wee bit, you know, and we're going to have to grab that, you know. I think health and safety has suffered from being able to beat up by the media about, you know, about kind of the Bannon Conkers Brigade and all that sort of stuff, you know, and we're a bunch of sort of joyless people that don't want people to live kind of full lives, you know. Tell that to somebody who's had a workplace accident, trying to live a full life, you know. So, you know, I think we'll have to look at that around the kind of promotion of health and safety and how we attract people to it. I'll go into that a wee bit, but, you know, so basically the issue, and it's difficult a wee bit to speak today. I mean, I know we're talking about looking forward, you know, and it's possibly easier for me to look forward. I've been working from home for the last year almost, you know, so I'm not going to just totally look forward. I'm going to look at, you know, what was I doing today? Well, I was actually dealing with 3 cases in the social care sector about people being told and bullied to go to their work. Two of them that had family members that had a positive COVID test, and they were meant to be not to be leaving the house. So yeah, I mean, we're not in a post-COVID environment yet, but we need to, you know, we need to look forward, and I think it's good to have events like this to plan and think about what the next steps could be. But in March this year, I kind of put myself forward at STUC to say, look, we need a net health and safety response to this, and myself and the Deputy General Secretary, we spoke with Hazards about what we tried to do in the STUC about COVID and workplaces and our negotiations with the Scottish Government. And one of the things we got an agreement on quite quickly was that we could promote the idea of roving reps, you know, that we could campaign for roving reps, and we could set up a system where there was an STUC email and a Hazards email system where a kind of workplace visit could be arranged by non-union workers. I have to say the take up on that has been very low, and my two main views on that are: one, I think people are really frightened to have a union person walk into their workplace and say, oh, I invited them in for a roving rep visit, you know, in a non-union workplace. So I think there's a bit of work to be done on that. And I also think as well, a lot of our reps have been absolutely too busy to go run around going to other workplaces. So in some ways it's been useful to kind of get to the bottom of that. We'll be feeding that back. I've had discussions with Kathy and Ian Tasker on it. You know, that's a real concern, and it maybe mirrors a little bit or echoes that conversation that we had earlier about our relationship with the Scottish Government. You know, in many ways there is a lot of positivity around the discussions, but sometimes the bolts to get things in place and the kind of practical kind of legislative changes needed aren't there to kind of move it on, you know. So we'll have to, you know, we'll rethink that, but we'll keep pursuing it, you know. But what we have done over the last year is we set up what we call a community health and safety rep. So we've got a couple of hundred health and safety reps on our network, Scottish health and safety reps, and we asked them what they wanted, and we set up a series of what we call webinars. We had 8 webinars over the kind of late spring last year and the summer and early autumn, just letting them feed in, giving them a safe space to talk, focusing on specific sectors, education, social care, further education, health, you know, just letting them talk, letting them communicate, you know, because I think one of the things we were concerned was, you know, the sort of isolation of people in our reps, and how could we kind of, you know, make it possible for reps still to communicate. What we've gone on to do from that is we've designed a couple of courses that we hope complement TEC education, you know, but that again, for our community reps, we're running our second course at the moment, just to kind of outline, you know, some of the principles of health and safety, provide a supportive network for reps. And I think it's really important, I think, I work for the STUC, organisations like the STUC actively support our reps. And I think one of the ways to do that is to sometimes give them a safe space to come and speak and share, you know, and share ideas. And that's one of the things we've really tried to create on these courses and webinars. And we've already, you know, we've picked up a number of ideas from reps and discuss things. I'll go into that a bit. I mean, one of the things we quickly found out is we need new health and safety reps. We need more health and safety reps. I've also got an idea that I wanted to sort of share as well around health and safety, that I think we should be building teams of health and safety people in workplaces, not necessarily just a rep. I think in some ways it could be quite a shift, but I think on health and safety, we need groups of people, reps working on this. I'm a great fan of a rep having a number of people around them. I think we've built a model a little bit where we have the health and safety expert in the workplace. And I think it's actually unfair on that one individual sometimes. And I also think it lends itself to a lack of rotation and lack of recruitment of newer reps. And I'm not by no means saying, I know that as a health and safety rep myself, the health and safety reps have to be qualified, they have to be trained. I think we'll have to look at that model and how we build kind of teams of people around them that can assist, that can, like Ian spoke about, also have some powers of investigation and stuff like that. We've also found, and I think Hilda touched on it, that disability and equality issues, there's a complete crossover on health and safety issues. And one of the things that we've put forward on our courses is to get health and safety reps meeting with the quality reps, and we have somebody for the STUC Qualities Committee comes and speaks on the course, but it's for both sets of reps just to get invited to the health and safety meeting. So health and safety rep goes to the qualities meeting, the qualities rep goes to the health and safety meeting. Sometimes we'll have to look inward there a bit as well at how unions work, because there was a number of health and safety reps saying, yeah, we've got on a qualities committee, but I'm not sure what fence I have to jump over to go to their meeting or whatever, and vice versa with the quality reps. So I prefer the term networks rather than too many committees, and having the person with the right principles there is the most important thing. The individual can be important as well, but just making sure that we've got, got a fluid nature of coverage. So kind of working on that. One of the things we've picked up, and I'm worried this might go down like a lead balloon here, but the Fair Work agenda, I think there's traction on this in Scotland. I really do. I've looked at, there's certainly traction on the commentary and the conversations around it and the vocabulary. I know that, but I actually think there's some key parts to it that unions can really work with here, and specifically, I think on health and safety. I share a lot of reps' frustrations. I do. I work with Des on support at work. I'm on the ground as well. I mean, I find it frustrating if I go to Edinburgh City Council or Scottish Government event, and there's somebody going off about Fair Work, and I get back home, or as I am now, or working from home, and there's 3 missed calls, and the social care workers who've been told to go to work. I understand the kind of, the distance there and why they're not. But I do think there are components in Fair Work that can be used to enhance the sort of trade union movement and to reach people that unions really can't reach at the moment, or are having difficulties reaching. So we've also looked at a little bit around the term, and this is a bit about around leadership. And I think we've kind of discussed that on courses and kind of trying to, reps are comfortable, kind of use that terminology a bit more. And I think there's some people will have their views on it, but it's interesting on some of the courses we speak about what people do, we have a roundup of what people are doing, and then we sometimes go into leadership, and there's usually the minority see themselves as leaders, but they're absolutely led on what they've been trying to achieve. It's quite clear to me, they're showing leadership. And I think Kathy and I often talk about just trying to move away from that hierarchical leadership role, and people seeing themselves as leaders and having a bit of power and using what power they have. Going forward, I mean, I think there's helpful discussions as well. If I look at the social care sector in Scotland around the National Care Service, and I think the report that came out in 2019 was a bit of 1920, there was a bit of a landmark report on social care in Scotland. and it was a fair work report, you know, and it didn't point directly towards a national care service. It kind of alluded to it, and I think there is positive movement towards that. I get frustrated a little bit for workers in the care sector and on regulation. It sometimes seems there's sort of too much regulation in there, but nobody's supporting the worker. It's like, you know, they're worried about this regulator and that one, but nobody actually seems to be enabling people to do their job healthily and safely and have good rights at work. Seems all a sort of like a mishmash of care commission this, health and safety posted missing, you know, but workers are actually really scared on regulation. You know, regulation shouldn't really scare the worker. It should be the bad employers that are scared of it. And I constantly hear from social care workers, you know, that they're scared of, that are doing their job as well as they can. They're scared the kind of regulatory sanctions on them. It just seems really lopsided to me. So I think there needs to be quite a lot of work done on that to make it workable and practical for workers, you know, and to make kind of safe work achievable. Because until we get to the bottom of that, I do think the National Care Service agenda is the way forward. You know, I think it's too, some of the outsourcing on care is, it just, Ian mentioned the power, and the power, it takes you so long to find out who's actually running the show. You know, and then by the time you find out they've sort of scarpered, you know, it's just, you know, you spend it, you know, is it this one? Then it's, you know, they're going around the doors to find out who you need to send a letter to or email. It really does need, there's a streamlining on how it's sourced and who's the head honchos that needs to be done so that we can speak with them and deal with them. Sorry for that's a little bit, you know, maybe slightly blunt, but that's the way I feel about it the day after 3 lengthy phone calls and situations. Going forward, we're going to continue the courses that we have. We're going to look at recruitment of reps. I've emailed colleagues in the STUC to say, look, this cannot just come from the reps. This has to be an agenda at policy level with the Scottish Government, with the UK Government, with Hazards, you know, to say, how do we enable the recruitment of more reps, you know, and how are they given powers? I'd like people's thoughts on the idea of a union safety team. I think it could be a way forward to increase powers of investigation, keep an eye on things a bit better, take a bit of onus off the individual, and maybe help rotation of reps. 2 of the courses that Hazards have run as well with STC, one was with black workers as well, the Black Workers Committee, and precarious workers. So a lot of investigation going into sectors in kind of non-unionised retail, fast foods, areas like that. And we're hoping to have, or we're going to have a kind of feedback event from the courses where we bring all those groups together. I think what we don't want to have is union health and safety experts having a meeting and then new union reps having a meeting and then people somewhere in the middle. We need to bring, you know, we need to move together as a collective, you know, and not have different kind of sections of you know, oh, they're an expert, they go to big meetings, they're a rep, they don't really want to. We really need to kind of learn from each other going forward on this, you know. Not sure I've got anything much more to say. I do think the idea of being the community development officer, this community of reps, so it was something I really pushed for in the STUC about looking after our reps. I know there's TUC Education that run the courses. We will try and direct reps towards that. I'll feed back on what issues are coming up for reps so that maybe TUC Education can kind of glean from that and we can glean from them. I think we need to kind of really support our reps going forward. Some of our reps are pretty tired. And I think fatigue's a real issue. You know, our reps are human beings. And as I said, I've pushed it in the STC that this community will have that role at its heart, that we kind of support our reps and provide a safe place for them to come and talk. And I think when you provide that safe place, that's when people some of the greatest ideas on workplace, not just on workplace, on how to work, have come from health and safety reps, you know, but people need a safe place to talk about them, you know, and not to be fighting with employers all the time. We need to have a place for sharing good ideas as well, you know. I've certainly had enough of them at the kind of at these events, you know, and there was. I mean, it's been great. One rep, fairly newly elected, working in early years childcare, you know, taking action about closing the workplace down. She didn't want it, but because there hadn't been a deep clean, and stand on the ground. And I totally echo what Hilda says: is there's no silver bullet for this. This is the long haul. We have to be aware that the Tories, the private marketeers, they're planning on opening up in workplaces, you know, and health and safety is not at its core. So we have to have plans and ideas and be willing to put them forward. So that's enough from me. I'll leave it at that. Thanks, Kathy.
Thank you so much, Terry. That's given us a lot of food for thought. So we have considerable, we've got 20 minutes or so. So let me know who would like to speak, ask questions, make points. Okay, Margaret.
Wait, sorry, I couldn't find the hand to stick up.
Don't worry, that's fine. I can see you.
Right. I was sort of thinking about what the last speaker was saying. I am a strange beast. I am the disability and health and safety steward for Lothian Health. So it's Unison. So I basically look after the disabled members, but also the health and safety of disabled members. And I also am on the equality seat for the management for disability. And it's quite interesting that the view that somebody who views it from a disabled point of view often has a very different view to actual able-bodied health and safety reps. And that can make quite a difference. Things like there was should I say the new children's hospital, or should I just run away at this point in time? They had built it all and it was very beautiful. And the director said, "Oh, Margaret, could you come and have a look at it?" And I came away with over 300 things that disabled employees would have difficulty with. I mean, beautiful oak doors, they're gorgeous. I couldn't open them. And nobody who's in a wheelchair could open them either. And they said, "Oh, well, we'll lock them back. And it's only when the fire alarm goes off." So I said, "Right, when the fire alarm goes off and there's a fire, you're going to lock your disabled staff in." Oh. So there is a tremendous amount that can be achieved, but we are very lucky in NHS Lothian that we have a very strong union presence. But of all the unions that are in the NHS, Unison's the only one to have a disability steward. And Unison's the only one to have a disability steward who also is qualified in health and safety. Now, I'm not I shouldn't be a unique person. There should be one for every single union. So I'm very much in favour of these teams, because if it's something extremely technical, I'll go to Reg Lloyd. And I know you all probably know Reg. So that I think is really important, that I know enough to know what I don't know. And as a team, we work together. But I bring the disability side that they don't often think about.
Thank you very much, Margaret. I think that's just great to have that voice in here. Can I just give, we've got several people with their hands up, but if I just gave Terry and Hilda just a few minutes to respond to that, so I think it's an important point.
I think I was also speaking there, Margaret and everyone from an STC perspective, and I'm actually challenging the ways the STC about the equality committees and making. One of my roles in the course is to make sure these equality committees are open to health and safety issues. Do you know what I mean? And so in some ways, I think from the courses we've had health and safety reps ask questions of the STC Black Workers Committee, the STC Disabled Workers Committee, but just many reps didn't actually know they could do that because they were a health and safety rep, you know, in many ways, or they weren't aware of the way they could do that. And the way they do it is you just go and do it, just ask it. But, you know, in some ways you have to kind of alert reps that that's available to them. So
yes, because how it works with me is I don't really have a direct caseload. I may have an occasional member, but mostly it's their local rep who comes to me because it's a disability issue, and I support the rep to support the member. And that's how it works. So I think that's actually quite a good way of doing it, because I'm not undermining the local rep, the local stewards, but I'm supporting them, because there's no way they can know all the nuances and ins and outs of not just the Equality Act, but everything that sort of surrounds it and all the British standards that go around it, and actually make more sense than I would say that I don't like the Equality Act. I think it's lacking teeth. And there's been 13 cases that I've heard of regarding disability parking, where the organisation has said, oh, but the Equality Act doesn't say, you know, that how many parking spaces we have to have or anything like that, until I point out the British standards is quite clear on it. How many, it's a parking space per disabled worker plus 10%, and it doesn't matter if you own the building or not. And it's quite interesting that there have been 13 cases brought to court, and British standards has trumped the Equality Act every single time.
Interesting. Hilda, do you want to come back?
Yeah, I think that's brilliant, and I'd always want Margaret to support me. What a fantastic rep that you are. And I think that business about, supporting other reps to support their members is the right sort of way to go. And there are lots of really interesting things in there. And I think Terry's point about, and Margaret backing that up, really about the point about teams of people working together. It's really about not having silos and not having this idea that, equalities is out there and equalities is just one issue on its own that doesn't actually interlink and intersect with everything else. Or health and safety is the same. I think, all these things actually intersect. And I think it's really not so much about those people, those reps becoming experts and being on their own, although I think that is a real danger and it can be something that puts people off. The team working, I think, really comes from, locating those issues in the work of the branch. This is what the branch does, or the workplace union organisation. It's not about the safety rep deals with health and safety issues. It's about the branch deals with all these issues and then supports the individual reps, and the rep actually informs them, and they deal with it as a branch. And I think that often doesn't happen. I think the more people are involved in it, the better. But it is about, the branch owning all those sort of issues, and health and safety. All these issues should be, at the heart of, the quality of work and how do we make work better. And so I think, union branches need to, locate all those things much more clearly and make sure that, they're working in that sort of way and not just leaving health and safety to the health and safety rep or the health and safety officer, or equalities to that sort of person. And we don't get caught up in silos, and we look at the ways these intersect with each other. And I think that is the way in which, the best branches actually operate.
Thanks, Hilda. I have Donnie, Ian and Penny want to come in. Can I just find out if there's anybody who hasn't spoken yet who'd like to come in first before I bring them in? I'm not seeing any signs. So, Donnie, do you want to go first? And if we can keep it reasonably brief, we've got a quarter of an hour left, so there should be time.
Sure, absolutely. We shouldn't come in more than once, but if there's
that's
nobody...
all right. That's...
Thanks. Yeah, I mean, just in terms of what Terry was saying about sort of networks, I think it's really important, and it's something that it's incredibly possible to do during the pandemic. We've set up, there's 26 colleges further education colleges in Scotland, and we set up a safety reps network. We meet every fortnight and we exchange information, and it's absolutely invaluable. We've got gas experts, we've got ventilation experts, we've got legal experts, we've got all sorts of experience. And so just to give you an example of the way it can work, we had, there was a particular problem at South Lanarkshire College where the principal was trying to break all the guidance and bringing loads of people in. When I say we, I mean, reps were able to visit the branch meeting from around the country, give support. That branch was able to bring in Section 44, declare a grievance, and start the movement towards a dispute, and the principal backed down. And that was a few weeks ago, and we managed that one. Today, I get an email from somebody saying they're bringing people in on the 22nd. What do I do about it? I've told the branch, I've told the principal that we're not going to accept it. What can I do? So I said, call a meeting. We'll come along. We'll go through what's been done in other places. In other words, that sharing, that network is absolutely invaluable. And it can be done because we're all completely mobile now. We could be anywhere in the country. So, you know, anybody can set up a network on really anything. And it's not about silos as well. But I think, you know, that's definitely a possibility that wasn't there before because people worked in their own workplaces. And what was Zoom? You know, we didn't know. But now we can use that stuff. That's me. Thanks.
That's really helpful. And I think we've all experienced that a bit. And Scottish Hazard certainly has been able to meet more often than we used to because of geographical distances and stuff. So that's a really helpful example. Ian and then Penny.
Thanks, Kath. Yeah, I totally agree with what Donnie said about networks. There's probably so many people on this call right now that are getting totally fed up with me emailing them every day. But what I wanted to say was a really big shout out to the STUC and Hazards 4-day course that Terry and Kath ran. I've been a steward and a health and safety rep for 25 plus years. And my motto is you never stop learning. And when I went on to that 4-day course, we had people from various industries and, you know, different experiences and all the rest. And like Terry, I worked in the railway previously and the brewery and some heavy industry. And you're always, regardless of your knowledge, you're always learning. You never ever know everything. So there's a lot of unions in this call tonight. And if you've got influence in other reps, I would highly recommend that you get one of these 4-day courses. One of the other points that Terry raised was with regards to the equalities officer and the health and safety officer. I've believed for many years, prior to being in Unison, I was with T&G, that equalities and health and safety are integrated. Because if you have an equality issue, discrimination or anything like that, it's going to affect your home life, it's going to affect your work life, it'll affect relationships, and eventually it will become a health, safety and well-being issue. And what Margaret was saying earlier about the incidents that she was dealing with for disabled workers, I actually had our first disabled incident last week where a deaf person had to go and get a COVID test. Thankfully, it was negative, but it caused so much panic because the person was totally deaf and he communicated through either hand and post-its or close-up kind of lip reading and hand signals. But until that point, very few of the managers in Street Cleansing had actually given any thought to the fact that, you know, we had a disabled member on the site, and everything worked out fine in the end. So yeah, that's me, Kath. Thanks.
Thanks very much, Ian. Penny.
Yeah, I think equalities run through health and safety like a thread, and through trade union, you know, our values like a thread, because if part-time workers are treated like shit, if you're Black or you're Asian or you are disabled, and you're treated much, much worse than everybody else, everyone suffers. We're all weakened by those fault lines, and it's only the boss that benefits. And I have to think, you know, I have thought this for a long time, but if it's not too bold a claim, I felt like Hilda Palmer's psychic twin for quite a while, because everything that she says is in my head, and I agree with it always. But I think, Terry, thank you very much for talking about the very important issue of twins, and when Hilda say of teams, you know, as health and safety is so important, and when Hilda says that safety reps are exhausted, yes, they are, but it really is grieving, you know. And I think, you know, the experience in Edinburgh College has been quite important for us to see how we've got 6 safety reps campus-wide and 1 branch official, who is Don, is health and safety, and 2 of us are trained up to the TUC diploma level, and both Don and I have delivered that in TUC courses. And one of the things that has really knitted people together is the fact that we fought for and won TUC training. And it's not just a 4-day course, and that's really important that people do that. But these are, the core courses are 10 days for health and safety 1, 10 days for health and safety 2, a year-long course for a diploma. And, you know, people feel, well, for a start, our managers are shitting bricks, because we said, you know, our reps really show that they know a lot more than the managers ever did know and could ever hope to know about health and safety. But also, we really do work as a team. And I think the important thing is that we don't do, I think it was Hilda that mentioned Chinese walls, it might have been someone else, the idea that we always have health and safety on the agenda. And if people don't have anything to report, that's fine. But there should always be that space for people in branch meetings and regular branch meetings. The Zoom meetings have been fabulous. I hope Unison has, you know, coming from the high Hegians in Unison, has stopped with we not to have any Zoom meetings, because they've been wonderful. We've had fabulous meetings, you know, which have really lit up. And I mean, the litmus test, I suppose, is the NEU, the Education Union down south, where they had 400,000 people at a union meeting, taking part in a union meeting in January, which within something like 7 hours changed UK government policy and stopped the teachers being forced back to school into unsafe environments. And that kind of democracy, led by safety reps who are concerned about their members, taking it to the members, that act of trust, taking it to the members, and that democracy that is available to us. And I think it's really, really important. And Don mentioned South Lanarkshire, and the thing that changed it, I mean, Don and John Kelly were speaking at the South Lanarkshire meeting, but it was the members. It was the members that said, we're not going back, that changed the environment completely and turned a principal who said, I won't be told who goes back in. And they're all essential. We're teaching medical staff. And in South Lanarkshire, what were they teaching? Induction courses to hair and beauty. Get a grip. You know what I mean? So they really got called out by the Herald, by the Sun, God knows what. And that's what health and safety reps and the branch members did together. So it's a team effort, but training is important. We should look at every avenue for that. Thank you. Sorry, a bit of a rant. Sorry.
It's okay, Penny. Thank you very much for your rant. Can I see if anybody else wants to come in? Margaret, would you like to come back in? Yeah.
Yes, sorry about that. I keep looking as if I'm waving to a boat.
No, that's fine.
We've talked so much about where we've been and where we want to go. I want to give everyone a little story to put things in context. My grandfather, who was born in 1890, was an engineer, a mechanical engineer, and one of his jobs was to remove the bits of people out of the machinery when they'd fallen into them, because there was no safety bars. Now, my middle daughter is a roads engineer. She works for South Lanarkshire Council. And 2 years ago, she had to remove a man out of a piece of machinery because he'd got dragged into an auger. Now, where's the change?
Well, I don't know what to say to that, except we have to keep going, don't we? Which I think is what you're saying.
Yes, exactly, exactly. And by the way, I had a fight with South Lanarkshire Council, or rather my eldest daughter did, because they have all the equality for the students up on their web pages. They didn't follow it with her. She has neurodiversity. And she went after them, and Mummy went after them, and we won, and she got her qualification. Good.
So anybody else would like to come in the last few minutes? I don't see anybody. I'd like to just say two things. One is from the courses. Thank you, Ian, for your response on the STUC courses. I'm glad that you found them it useful. One of the things that's come out from a few people who've been on those courses is that they are health and safety reps, and they are on, quote, health and safety committees, but they are one union rep amongst managers. And, you know, I knew that, I've always known that this happens, but I think we really need to be saying to reps, you know, what is a real health and safety committee, and, you know, not to be put in this position where you're one person among like 10 managers and trying to speak for everybody in the union or for all the workers. And the other point I wanted to make is, Hilda talked about enforcement being so important. And I think in Scotland, we need to think what we're asking for in terms of enforcement. I mean, Scottish Hazards has a standing policy, and I think the STUC does as well, to have health and safety devolved. Now, that is not going to be a magic wand, we know that, but it is something that I think we have felt would at least give us a fighting chance of improving things. So I'm saying that because it's kind of policy, but I don't know whether anybody disagrees with that, but I think we should have that on the agenda if we're looking forward. Anybody else before I bring in Hilda and Terry just to say a final word? Hilda?
Sorry, just thank you very much. You don't want to hear any more from me. Thank you very much indeed. It was really, really interesting to hear lots of expert testimony and input, and some absolutely brilliant work being done on challenging employers and coming up against the lack of legal backup and the lack of enforcement. But safety reps, as always, saving health and saving lives. Thank you very much for letting me speak to you, and thank you. It was great to hear you all tonight. Thank you.
Terry, do you want to say anything?
No, just thank you. Thanks for inviting me, Kathy. And as I said, I do sometimes, as I said, when we do our weekly round the screen at the training courses, I think, you know, wow, things are difficult. But if these 20 people weren't working away and persevering, we'd be in a much darker place. So, you know, just keep. We need more health and safety reps. We need more. I mean, don't want to get, somebody's put up already, one rep on a health and safety committee is not a functioning committee as far as I'm concerned. It's somebody probably absolutely stressed to the nth degree, but probably fighting a losing battle really. So we can't have that as a sort of model going forward for anybody.
It's against the safety reps and safety committees regs.
So we must
have, Penny's put that up. Yep.
Yeah.
We've told her that. Okay, well, it's just, I just want to say thank you for all of you for coming, and really thanks so much for Hilda and Terry giving us such good input and getting us discussing things. And we will circulate the slides. And if there's anything that people think about afterwards, just shout and we can all discuss it. So thank you so much and have a good evening.